Hello, my name is Dr. Briggs. I'm an intensive care consultant here in the UK, and I'm also Managing Director of Medical Support Offshore Limited. I'm a very keen sailor as well, and I did a round the world yacht race in 96-97. That was the Global Challenge. We're located here, Medical Support Offshore, on Saxon Wharf, which is an MDL marina in the middle of Southampton. In order to be able to provide good first aid on a vessel in the middle of nowhere, or a good first responder action, you need a pretty good medical kit. It's probably fair to say that the further you get offshore into more remote locations, you need more complex and more comprehensive medical kits, and you need more training as well. So this is an example of a private, what we call a distant ocean medical kit. This is just the grab bag part of it, and knowing how your medical kit is put together is very, very important, and having it put together in a nice kind of intuitive manner means that in an emergency you've got some kind of idea. You can remember exactly where things are. So this is like a typical kind of kit that we produce, and it has a list of everything which is in the kit up here. So for very easy reference, and then it's set out in a modular kind of format in these plastic kind of pouches, which are clearly labelled, and also they're quite see-through as well. So you've got some idea when you pick them up. You can see you have an idea about what you're looking for. But it's very well organised. But even the best organised medical kit you can have in the world, you still need to do training with it so that you can remember where things are. And that training really shouldn't just be once every 5 years. It should probably be quite a lot more frequently than that. What you actually need to do is pretty straightforward. So on our training courses, what we try and teach is we try and teach a framework within which to think. And the basic framework, which I'm sure that you'll have heard of previously, is a system of ABC. So kind of you approach and you assess you approach so to make sure that you're not going to become injured or fall over the boat yourself. You're going to assess do an immediate assessment of the casualty or the person with a medical illness to make sure to see whether they're conscious or not. And then you're going to go into an assessment of airway, and then breathing, and then circulation. The most important thing is to do something. So, and not be frozen by the enormity of what you might see, because a lot of people sailing on vessels is that they're sailing with their family or very, very close crew members, and if they are badly hurt or have a very bad medical illness, the emotional kind of impact that can have on people, such as like a half a litre of blood landing on the deck, that can actually paralyse people and stop them acting. So the way that we try and teach people, and the way that the kits are set out, that it's like a framework, so that you can continue to have a reference point about what your next action should be. Okay, another example of the type of kit that can be used is this, and this is a trauma kit, as you can see here, and so this is based around that framework within which to think, which is approach, assess, airway, breathing, circulation. So, and this is for the management of trauma, and it's designed to manage the 30 minutes between incident and then transfer to definitive care. So definitive care may be a shoreside ambulance or even the hospital. But it's that 30 minutes. That we talk about the golden hour, but it's a very, very golden 30 minutes. So, and this is based around so approach, assess. So we've got assessment here, and then we've got airway and breathing in here. And we've got some oxygen here as well, and we have a pulse oximeter in there to be able to monitor exactly what our oxygen saturations might be. And then we've got immobilization and wound management, and this basically is circulation, and it's to stop people bleeding. So it's got procoagulants in it, special dressings, and also strapping to provide direct pressure on external bleeding points, which is the most effective way of stopping bleeding. As everybody knows, after COVID times, pulse oximeters have become very, very much more available and tell us really good objective data about how a patient is doing. It's really sophisticated technology, but really quite simple to use. As an example of this, so combining the global communications and the vital signs point of care testing into a telemedical communication platform, we have something like this. So this is a sophisticated piece of kit, but the principles behind it are very, very straightforward. So we've got the capacity to be able to measure, this is a pulse oximeter, so this will give us saturations, oxygen saturations in the blood and also pulse rate. This is an ECG monitor, so this will measure the electrical output from the heart. This is a blood pressure device. This gives us temperature, and this gives us blood glucose and some other parameters as well. And then we have a peak flow device as well. So this is for people who are asthmatic or who've got bad lungs. Basically, all these devices communicate with this tablet here. And this tablet then is plugged into the vessel router via satellite connection to the internet, and then we have a remote server and a remote control room that we can monitor all this data back at base. Okay, so I hope you found this interesting and informative. Part of this is supposed to provoke thought with yourself about the risks that you take in terms of both trauma and also medical illness risks that you take when you go sailing off away from immediate help. And so it's a good idea to have a think about what may happen and how you're going to cope with the consequences of that. And so, getting some form of medical kit from somewhere and getting some regular training is pretty paramount. And depending on how far you go offshore, potentially access to a telemedical support service might be a good idea as well. But it really depends on your assessment and approach to risks yourselves, for both the captain and also the crew on the vessel. So I wish you happy and safe sailing, and I hope all goes well. Thank you.